Of the many benefits of IONM is the fact that the patient can stay asleep throughout the entire procedure. One of the standards previously was that they would reduce the anesthesia, wake up the patient, and ask them to move their lower extremity. With IONM, it's the signals that validate that the patient's nervous system is still healthy, and so there's no need to wake them up during the procedure. Of the many things that are important to performing intraoperative neurophysiologic monitoring well is being educated and exposed. It's one thing for someone to read a textbook and get background information about intraoperative monitoring or neurophysiology. It's another thing to get practical exposure in the operating room to understand what it means to set up a patient and troubleshoot signals, and also to understand in depth all the surgical steps and when they put and how they put the nervous system at risk. Of the many features of NeuroAlert that distinguish it from other intraoperative neurophysiologic monitoring companies is the fact that we structure our company around building relationships. We build relationships with the surgeons, with our supervising physicians, with the hospital administration, with our surgical neurophysiologists and our team members. Relationships such as these are important because they build trust and understanding. It's the best way to provide the most optimum patient care. When you think of IONM, you're thinking of cases particularly that relate to the spine. Spinal deformity procedures, correction of instability in the spine, spinal compression surgery like a herniated disc, and particularly when there are fusion or metal elements that go into the spine to stabilize the spine. Recently, NeuroAlert participated in the separation of conjoined twins. 1-year-old babies were having surgery to separate them from the hip. NeuroAlert is very proud to participate in the surgery. It's a very rare opportunity, and we provided valuable information for the surgeons so that they had a good understanding of where they could separate these twins' nervous system. Another surgery that we participated in recently was an awake craniotomy. The patient had a tumor that was positioned between their language and motor centers in the brain, and we were able to help the surgeon map those areas, protecting the function for the language and motor areas. At NeuroAlert, we have an extensive and deep education and training program. The students start in the classroom where they gain the background information that they need and gain an understanding of the fundamentals and the principles of neurophysiology. After their didactic program, they go out into the field where they participate practically, setting up patients and performing the intraoperative monitoring with a supervisor. Gradually, they go from observation to participation until eventually they're cleared to cover cases on their own. The Center for Electroneurodiagnostics is a training program to teach people how to do intraoperative neurophysiologic monitoring. The program was founded by NeuroAlert's founder, Dr. Sation, and we're very proud that much of the content was contributed by Dr. Sation. We're also very proud of the fact that the program has already a great track record of success, wherein several of the people who have gone through it are already certified immediately upon its completion.